Yes, I'm Campbell. I'm a GP here, and everything you're about to hear, there's no other reason for me telling you about it other than I completely believe in it and think it can make a massive difference. Okay. And just before I go on, I read recently, how do you know you're passionate about something? And the answer to that was, you never stop talking about it. And my wife is very, very, very happy I'm here tonight. Just a quick note, because I'll forget if I haven't put it on here. If you do have diabetes and you're on medication for that diabetes, what I'm about to tell you, make sure you speak to your GP before doing anything drastic with your diet. There are some drugs used in diabetes. If you change how you eat, it can make your blood sugar go too low. So that's my clinical disclaimer. So we're going to cover four things. Being human, what's currently happening in this world of nutrition, how do we get to where we currently are, and then some suggestions for the way forward, okay? So being human. So this is the Human 5 model, which came about 4 or 5 years ago after studying athletes at sports and exercise medicine, realising that athletes perform their best by looking after a number of facets of themselves: their mind, their movement, their nutrition, their body and their world. And it dawned on me, what on earth are we doing in medicine? These athletes do that because they're human. We should be looking at all these facets in medicine as well, and we generally haven't. We generally focused on the disease and then drugging the disease. So when my eyes opened to that, after 10, 12 years of studying medicine and then being a GP, the world changed, and suddenly many of the problems we were seeing had new solutions. So tonight we're really talking about nutrition, but what I want to make really clear is nothing exists in isolation, and nutrition is part of a number of different areas, including the physical activity stuff that happens in Somerset with the amazing Zing, yeah, people's journeys are all different, so I just want to make that really clear. And there's also a statement there, what matters to you, or what's important to you. That is an incredibly important statement. The way I see the world and what's important to me, it'll be different for all of us. And so when you hear anything tonight, it's about reflecting on yourself as far more than what I'm saying and how it works. Okay. So what's currently happening? So in Somerset, about 7 to 8% of people have type 2 diabetes. It's about 35,000 people. It's about 1 in 12, 1 in 13 people. About a third of the people in the UK have something called pre-diabetes, which is the blood sugar's risen to a certain level, but it's not quite the diabetic level. About 2/3 of adults in the UK are overweight or obese. And the total cost to health and social care in Somerset is about 148 million. And I think that gives you an idea that we've been doing something wrong. People haven't been doing something wrong, the system's been doing something wrong, because this wasn't the case 20 years ago. So as a GP, I used to, for all of those things, I used to advise eat less calories and move more. And many, many, many people know that sometimes that works in the short term, sometimes it doesn't work at all, but generally speaking, it doesn't work for a lifetime. But that's what I used to recommend, because that's what I learned at medical school. You put on body weight if you eat less, if you eat too much and you don't exercise enough. And yeah, I was doing my job, I thought. And basically, if that fails, and we used to prescribe a lot more drugs now for people that are overweight, you have some pills, or if people develop diabetes, what you need is some drugs, because you're not, obviously can't do the eat less and move more. It's not, you're failing at it. It was the I would hope I'd never say that, but that's the general implied comment that's made. So we prescribe drugs. And I never really stopped to think why, even having been brought up by an engineer. My medical training had knocked out of me the asking why. Just follow the textbook. So I never really stopped to ask why, and just carried on merrily. Then about 4 years ago, I stopped and I sort of started questioning why am I seeing what I'm seeing? Every day seeing 30, 40 patients, why am I seeing this coming in the door? Why are we seeing more diabetes? Why are we seeing more problems related to lifestyle? And why am I having no impact on those? I'm just prescribing more drugs. And then I realised, after scratching the surface a bit, I'd been wrong, very, very, very wrong in what I was thinking, what I was advising. And we've been looking at the problem in completely the wrong way, and incredibly probably making it worse, not better. So if people had followed the advice I had been given, they were probably getting worse. So hopefully not that many people were following my advice a few years ago. I'm going to talk you through the story now of how do we get to the place where me, with all my good intentions, was actually possibly making people worse. And it's a slightly complex story, but it's simple in other ways. So the history to this was in the United States in the 50s and 60s. There was a chap called Ansel Keys, who was a physiologist. And he did a lot of studies on people around the world and in countries, and he came up with something called the diet-heart hypothesis, which is if you eat saturated fat, you will raise your cholesterol and you will get heart disease. Now, there was lots of controversy around this, and lots of people didn't believe it, but as I understand it, and what I've read about him, he was quite a powerful character and quite persuasive. And at the same time, I think President Eisenhower had a heart attack, which created this real political drive. So he was really on the case, pushing fat's bad for us. In the UK in the 60s and 70s, there was a chap called John Yudkin, who was apparently a slightly milder-mannered person, a scientist, and he was convinced sugar was the problem, and even wrote this book, Pure White and Deadly. And I think there was a bit of a battle, and from what I've read, Europe was sort of saying to the US, no, you're wrong, it's not that, and the US was saying, yes, it is, it's the diet-heart hypothesis is what's right. And that raged for a while, and in the 1980s, the United States introduced their very first dietary guidelines, something called the food pyramid, which at the base was a lot of bread and things like that, rice, and then 3 years later, the UK followed, and we produced our first dietary guidelines. And this is the most up-to-date version of those dietary guidelines. So they've been running for about 35 years now, 34 years. Now called the Eat Well Guide. So this is our standard authoritative dietary guidelines, which some of you, I'm sure, will have seen something similar to this before. And what I want you to notice on here is a third of the plate is starchy carbohydrate, as it's called, and I'll tell you what that is if you, in a moment as well. So you've got about a third of the plate starchy carbohydrate. You've got lots of good veg and stuff over that side, which is great, and a bit of fish and eggs and things in the middle. And then here you've got low-fat stuff, so very much margarine, not butter, low-fat spreads, skim milk or milk alternatives. Try and keep the fat as low as you can. So that's our standard advice, most up-to-date national advice there now. And there's a bit of junk food over there, and they're sort of saying a bit in moderation is okay. So that's what we've been living with in the UK for about 34 years, influencing what we eat, what's on the shelves, a traffic light system on the front of food, what's red, what's green. So people were encouraged to eat what we now commonly know as the healthy balanced diet, is what we call it. I think when you stop and question that statement, it doesn't really make a lot of sense. What does healthy balanced diet mean? It's supposed to mean that previous slide, which means lots of carbohydrate and no fat. So we started eating a diet that was higher in carbohydrate and lower in fat, and everyone thought that was a great idea, including me. And then something happened following these. And this is a graph of children around the world, and the red line is England. And this is about 1983 here when our dietary guidelines were introduced. And this is what happened to childhood obesity shortly after. It could just be coincidence, there could be something completely else doing this, but I think we've got to ask the question, was the change in guidelines relevant? I struggled to find a graph for adults in England, so here's going back to 1983 or before, but here's what's happened since 1993 up until 2009. So percentage of men and women who are overweight or obese has been steadily climbing. So lots of people have been asking the question now, well, hang on a minute, if we've been following the advice that we were supposed to follow, and it can't be, well, what we've been saying is people aren't following it. It's the people that are wrong, we've got the right guidelines, it's the people that are wrong. And we've been saying that for 34 years now, and I personally think it's time to change the advice. And hopefully I can tell you why. So diabetes, again, I couldn't find the data back to 1983 because it possibly wasn't recorded in such a clear way. But this study or this report, journal article from British Medical Journal 2016, type 2 diabetes, year 2000, 2.39% of the population had it, that's including kids, in that population equation. And 13 years later, it more than doubled. So again, humans, go back 100 years, hardly anyone had type 2 diabetes. I think even go back 40 years, hardly anyone had it. It was rare, but it's just going north. In some parts of the world, I think Pacific Islands, they've got 50% of people have type 2 diabetes now. So something's going on, and how is this happening? So the science, this sort of stuff's been going on, and I'll explain why. Just before I do that, being overweight, definition of being overweight really is having more body fat than is deemed necessary to sort of survive and thrive, is my way of looking at it, and that could be fat under the skin or it could be fat on the tummy. In the current kind of guidelines, being overweight is a BMI, so that's your height and your weight, and its calculation is when your BMI is greater than 25. Type 2 diabetes is a condition of too much sugar, glucose in the blood. And that's what we measure, that's how it gets diagnosed. It's also, and we don't really focus on this very much to date, it's also a condition of insulin resistance. Insulin's a hormone, which I'll tell you about in a minute, that brings down blood sugar level. So in type 2 diabetes, if sugar level's high, and the insulin that your body makes to try and bring it down, your body's resisting that insulin. So as a result, we also have very high insulin levels. So you've got high sugar levels, high insulin levels, and your body's trying to push back, saying, so it's being insulin resistant. So question, by the way, I never pick on anyone in talks, so you can sit and relax, but if anybody wants to shout out, does anyone know how much blood is in the average adult? Heard 8 pints, yeah, 8 pints, 5 litres if you're in metric. Does anybody know, in all of that blood, roughly how much glucose is supposed to be in the blood for a normal blood sugar level? Anybody know? Yeah, around about 5 grams, which is brilliant. So just for the visual, it's it'd be a big teaspoon of sugar. So in 8 pints of blood, 5 litres of blood, there is 1 teaspoon of sugar. Which for me, when we talk about sugar concentration, glucose concentration in the blood all the time, but I never stopped to calculate it into what that meant in grams. And when the penny dropped again a few years ago for me, thinking, wow, that's not very much. So I thought, what happens when you eat 50 grams of sugar? If you sit down and eat some sweeties or something, where does that go? So what happens if you eat glucose? So glucose is a common sugar, it's the sugar in our blood, can end up in 3 places in the body. So if you don't want more than 1 teaspoon in your blood, your body's got to get that out of the blood, and it can send it to 3 places, or do 3 things with it. It can burn it, use it for energy straight away. It can turn it into something called glycogen, which is effectively your body's starch. It's like a sugar store, an instant sugar store, and that's mainly in our muscles, and the stores in the muscles stay in the muscles, your body won't let them back out, or in the liver. Limited amount of that you can do. There's not that much space for sugar in that way, and the burning, how much sugar can you burn at any one moment? It's not a huge amount. So the only other route you can go, because you've got to keep your blood sugar level at the right level, otherwise it's going to instantly harm you, is your body turns it into fat. So a lot of that happens in the liver, the glucose gets turned into fat, a lot happens in the fat cells. So that keeps your blood sugar level normal, which is brilliant. And if all you're interested in the blood sugar level being normal, and you don't worry about what's going on here, then everyone's happy. And that's what we have done in medicine for a long time. As long as the blood sugar level's kept normal, then there's not a problem. Ignoring what's happening downstream of there. Okay. So starch, we mentioned on that Eat Well guide, there's 1/3 of the plate of starchy carbohydrate, and I'm just going to talk very quickly through what starch is, because I think I learnt it when I was 14 and then forgot it through my medical training and for the next 20 years. So if that's glucose, which is the sugar in our blood, which is that grey blob there, slightly oversimplified, but that's starch. It's just lots of glucose joined together. That's all it is. It's twists and turns and all sorts, but that's effectively what it is. And then there are different types of starch. Some starch is broken down very quickly into glucose and some's a bit slower. But effectively, what I want you to see from there is starch is glucose. Okay? And as soon as we eat it, we have an enzyme called amylase starts in our spit, and there's more further down the system that starts breaking that starch up into these little 2 glucose units called maltose. And then by the time it's gone through our stomach and onto our small intestine, there is another enzyme called maltase, and that splits these 2 things back into glucose. So not long after eating, that healthy starchy carbohydrate is effectively pure glucose in your gut. So it's very similar to eating spoonfuls of glucose, just it's a bit slower to turn into glucose. So I think that's really important, and again, often forgotten. This is just very briefly saying, so we get glucose or starch in our food, our liver, we need to keep 1 teaspoon of sugar in our blood. We don't want it to go lower than that. So our body's designed to up the sugar level if it needs to. So our liver is very, very, very clever at not only releasing these glycogen stores that I mentioned, it can also make sugar. So your body makes sugar, it's designed to make sugar, it should make sugar, made in the liver, and sends it out into the blood when it's needed. So sugar and glucose and starch is not essential for life. You can live your whole life with not ever, ever, ever eating one bit of it crossing your lips. Because that's what we're designed for. And we have all the kit to do that. So, just as a picture of how that translates real-life food into sugar, this is a chart designed by a GP in Southport, north of England, called Dr. David Unwin, and he was sort of talking about this stuff and he's recognising actually this doesn't translate into real life. So what this shows is the sugar equivalent of foods. So this is teaspoons of table sugar, and on that side they've got various foods. So at the top there you've got basmati rice, and it's an average serving, apparently 150 grams. So if you eat 150 grams of basmati rice, as far as your body's concerned, that's exactly the same as eating the same amount of glucose as about 11 teaspoons, or 10 teaspoons of sugar. That's the same amount of glucose going into your body. The potato, white boiled potatoes, 150 grams of white boiled potatoes, same as about 9 teaspoons of sugar. Spaghetti, white boiled spaghetti, 180 grams, it's about 6.5 teaspoons. Banana, a standard banana, it's about nearly 6 teaspoons. And then down at the bottom you've got broccoli and eggs, which don't really have any glucose in them. So again, I think that's really practical, helpful highlight of what our food is and what starch is and therefore what it does to our blood. And this has worked out something called the glycemic index, you might have heard. When you eat these foods, what happens to your blood sugar? And it's exactly the same. Eating 150 grams of basmati rice will have exactly the same effect on your blood sugar as those 10 teaspoons of sugar. Okay. So, if you had too much glucose in your blood, what would you do? Would you eat less glucose, eat the same amount of glucose, or more glucose? Who thinks A? Who thinks B? And who thinks C? So there is an option D, that if you've got too much glucose in your blood, you can drug your body to push the glucose out of the blood somewhere else. We don't care where it goes, but we'll just get it out of the blood, and then we can check the blood and say everything's fine. So I asked my 5-year-old daughter this question earlier on today, and she agreed with you guys. If there's too much glucose in your blood, you should eat less glucose, which smart. So how would you treat type 2 diabetes as a problem of too much glucose in the blood? Would you eat less glucose, eat the same amount of glucose, or eat more glucose? Who thinks A? B? D. So what we think in medicine is we'll drug the hell out of everyone and push that glucose out of the blood and forget about it, because we don't have to worry about if the blood glucose level's near normal. We're still thinking about how we got to where we are today. So the traditional advice for people with type 2 diabetes is The important thing in managing diabetes through your diet is to eat regularly and include starchy carbohydrates such as pasta. And that's on NHS Choice's website still today. So I just got that off there today, which doesn't seem a great idea, really. This is off a leaflet from Diabetes UK from 2011, and at each meal includes starchy carbohydrate foods in bread, pasta, chapatis, potatoes, yam, noodles, rice, and you can read the rest there. And just remember back to the other slide with the teaspoons of sugar, so if you've got high blood glucose, make sure you have loads of glucose to eat at every meal, is the advice that's being offered here. So, like you guys have already worked out, at last we have a solution that's been absolutely staring us in the face for at least 34 years. And with that, and what I'm seeing in daily practice and connecting with people all over the place, is suddenly there is a massive amount of hope. For even 5-6 years ago, I was thinking, wow, where is this going? Type 2 diabetes is rocketing. Everyone's getting overweight. Nobody wants to, nobody's choosing to, with the following advice, and it's not working. And it's because we've been doing completely and totally the wrong thing. So suddenly there's hope. This disaster that was happening is suddenly fixable relatively rapidly. And most importantly for me, instead of disempowering people when they come to see me by telling them to do the exact wrong thing, and when they fail, they're a failure, not me, people can now regain complete control of their own health and improve their health if they wish to, which is sounds a simple statement to make, but actually it's pretty huge. Everyone wants to be in control of their health. And it works, so you're going to hear Peter's story later, but this is a statement from somebody else in Wales. I was initially quite angry when told I could reverse my type 2 diabetes. I was angry because for 12 years the NHS, doctors, consultants and the internet told me the disease was irreversible and progressive. And of course they were right, if you follow the standard low-fat, high-carbohydrate dietary advice. I changed to a real food, low-carbohydrate, healthy fat diet in August last year thanks to my doctor. The results are, at least to me, a miracle. I no longer take diabetes pills or pills for gout or for high cholesterol, and I take less blood pressure pills. I have far more energy and I now enjoy life to the full. The low-carbohydrate, healthy fat lifestyle is easy to change to and, importantly, stick with. So that sort of stuff is, I get up in the morning to come to work because my personal mission is optimise individual and population health and well-being. And so for me, my day's worthwhile. People coming in and me just handing them drugs and people going back out again. If I know those drugs aren't really going to do much, it's not particularly inspiring to do 12 hours of that. But now I love my job and I'm passionate and I never shut up. This is possibly far too small to read, but I'm just going to, a bit of human psychology, light touch human psychology. The human brain is designed to frame things, and instead of working things out every time we come across a problem, we frame, we get a thing called a mental representation, and that's how we believe things happen. And out of that, we'll then make decisions. So if the previous belief of type 2 diabetes was it's a progressive disease, which is still what many of the textbooks are saying, if you go hunting on the internet it says, it often requires medication. It can cause heart disease, loss of sight, kidney disease, neuropathy, nerve problems, loss of limbs, increased infection, stroke. It's becoming increasingly prevalent. There's more of it around. Nobody's quite sure why. People aren't doing what they're told. Lifestyle changes might have an impact, but people find this difficult and struggle to maintain it. So the feeling that conjures up, at least for me, is a sort of sense of despair. And I suspect if I got diagnosed with type 2 diabetes and was told that, I would feel a bit of despair. The outcome of that model is increasing morbidity, which is ill health, increasing mortality, which is earlier deaths, and a health and social care system that collapses through expense. So that's the previous model. Emerging model, the beliefs, so it's preventable, it's reversible, even when you have it, you can reverse it. Lifestyle change is achievable and enjoyable. If you do this, you don't need medication, which in brackets, actually when you look at the studies for many of the drugs is a questionable benefit anyway. And then you don't get any complications of it. So the feeling this would conjure up in me, and probably for most people, is a sense of hope. And the outcome of that is improved health and well-being and significantly reduced health and social care costs. And that's where we are now, fortunately. And the world is actually changing. I didn't know this until today, but Diabetes UK in May of this year, the current evidence suggests that low-carb diets can be safe and effective for people with type 2 diabetes. They can help with weight loss and glucose management and reduce the risk of cardiovascular disease. So we can recommend the low-carb diet for some people with type 2 diabetes, which is, they've stayed on the fence a bit, but that's quite a monumental step for that statement to be made. There's been a lot of resistance for a lot of years, not acknowledging that if you have too much glucose in your blood, that perhaps eating less glucose is a good idea. That it wasn't accepted that, but it now is. But they've got the system to work through, I guess, without causing too much trouble. So yeah, it really is. Wow, it's from the medical world. That is. Where we are now is massive. It's the world can change. We're not set for doom. So we talked a bit about diabetes, but how about body weight and body fat? How does that link in? So going back to this picture, glucose and insulin leads to burning fuel, glycogen production or fat stores. So the important one when we think about body weight is this bit. And out of that, you can conclude that insulin causes the body to store fat. Again, going back to that really simple idea, or eat less, move more, we know that doesn't work, because why can two people eat the exact same amount of food and do the exact same amount of exercise and be the same weight and everything else, or the same build, but one person might have a bit more fat than the other? That immediately ruins that thing of eat less and move more. So there is something else going on in the body that causes the body to store fat. And there's many hormones, but insulin is the most important. If your insulin level is high, your body will store fat, not burn fat. If your insulin level is low, your body will burn fat, not store fat. So what you've got to think about is, how do we create a low insulin level rather than a high insulin level? And from very, very simply thinking about it, well, if the glucose is lower, the insulin will be lower. If the glucose is higher, the insulin will be higher. So we want to eat to lower our insulin. My perspective on body fat. So body fat, the fat under the skin, is relatively safe stuff. It doesn't cause you really any harm. And it's there as a kind of continued dumping ground, because glucose in the blood, if that goes high, that's pretty quickly dangerous. So by turning it into fat and dumping it under the skin, the body's dealt with the problem. So a lot of the time we blame body fat for the problems we're seeing, and I think that's completely wrong. I think we're seeing the body's protecting itself from other things going wrong sooner. So all this stuff about saying obesity causes all these problems, I don't think that's true. I think the obesity's been protecting people, and then the problems happen because the protection system stops working because it gets maxed out. There is also fat around your organs, though, and fat around the organs is not good for you. It sends other hormones around the body and causes a lot of trouble. And certain things will increase the amount of fat around your organs more than fat under your skin. Exercise, interestingly, although it's not a very good weight loss tool, actually it's a really bad weight loss tool, it is good at reducing fat from around your organs. So you can create health even if you don't lose weight by being physically active. Does that make some sort of simple sense? So anyway, think about, well, how do we lose body fat if you're wishing to? So how do you lower your insulin level? Do you eat less glucose? Or do you eat more glucose if you want to bring your insulin level down? Who thinks A? Less. That's right. So almost everyone thinks saying A, which is great. So eat less glucose, your insulin level will be lower. What have we been telling people for years? We've been saying you're overweight because you eat too much, you eat too many calories, therefore stop eating fat because fat's got more calories per gram, thinking we were when they work out how much calories stuff, they put it in a test tube and burn it with a Bunsen burner, and that's how many calories there are. So they're sort of saying, well, we just need to eat less calories, so because you're like a test tube and a Bunsen burner, so eat less fat. And what that means is you have to eat more glucose because you have to eat more carbohydrate if you're going to eat less fat. And what has that done? It puts your insulin levels up, and the carbohydrate gets turned into fat, and you're in fat storage mode, and the body can't access that fat because insulin's telling the fat stay in the fat stores, don't come out. So 2 or 3 hours later, you're starving because the insulin's holding the fat in the fat stores. And then you've got to go and eat some more, but you're not going to eat fat because we shouldn't eat fat. You're going to eat some more carbohydrate and glucose. And you're going to take some of that because the blood level needs to stay at 1 teaspoon. So you're going to turn it into fat and dump it into the fat stores, and then the insulin's going to lock it away in the fat stores. And it carries on and carries on and carries on. So yeah, so long before type 2 diabetes develops in people, we've been going through this challenge every day. So if you eat every day, you're eating that's pushing your glucose level up, and then the body's got to raise its insulin level to bring that glucose down and get it out of the blood, turn it into fat or whatever. And then you're doing that all the time. And what the body starts to do is say, hang on a minute, why am I your dumping ground? Why are we having to take on all this, turn it into fat? So it starts to push back, and you become a little bit what's called insulin resistant. So the same sugar riser needs a bit more insulin to bring the sugar back down, and the next year a bit more insulin resistant. The body's saying, stop it, I don't want to have to deal with all this. And eventually you get to a stage where your insulin levels are up here, when 10, 15, 20, 30 years ago, to keep the sugar there, they were down there. Now, insulin tells your body to store fat, don't burn fat. So at this point, eating a very small amount of food that raises your blood sugar, you get a rocketing insulin level, and you cannot access your fat stores. And this is why people often get heavier as they get older. It's because of the slowly developing insulin resistance. And then what happens? So diabetes. So your insulin level's been up here, and your sugar's under control. You've been coming into me, and I say, yep, great, sugar level's fine. We don't measure the insulin, so who cares? And then one day, the body goes, stop it. We can't take any more. We've had enough of this. We're going to start pushing back. And the way it does this, fat starts getting laid down in your pancreas, which is where the insulin's made, and the insulin level falls a bit. And then the blood sugar level comes up. What I was taught at medical school is that there's not enough insulin. So we need to treat that with insulin, and this is still done. So we'd forget that insulin's actually should be down here, and it's still up here. It's not here anymore, but it's here. I know what we'll do. We'll tell people to take drugs that push their insulin level higher. Now, insulin tells your body to store fat, not burn fat. So we then say to people, right, go away and eat loads of glucose, and we're going to give you some drugs to push your insulin level even higher. So you're going to put on weight. We don't tell people that, but that's what will happen. And then eventually they become a bit more insulin resistant, even though we've been giving them the drugs. And then this amount of insulin doesn't work. So then the blood sugar starts rising. So, right, we need another drug. So we give some more drugs to squeeze the insulin a bit more. And then eventually we say, well, none of those drugs are working and everything's failed and you're a failure, so we'll start prescribing you some insulin to inject, and we'll take the insulin levels up to here. But then a few years later we'll give a bit more insulin. And all that time the body has just been driven into this fat storage mode. The people feel terrible. 3 hours after eating you're starving because you can't access your natural stores. The brain's not happy. And it's really miserable for people. And all of that process is what causes the end result problems that you see with diabetes. Not a great plan, really, actually, when you scratch the surface, and quite upsetting, I would say, for most people. Okay, this slide, very busy, so don't need to take it in. I made it for another purpose, but what this says is, in this middle bit is this insulin resistance, high insulin. So we're getting this challenging the body all the time. The body's pushing back we resistance, so the body goes, well, have some more insulin. And that vicious cycle starts up, and it creates what we know, something called metabolic syndrome, which can be diagnosed. We often don't look for it for some reason, but it can be. What causes that main issue is that processed food, sugar, refined carbohydrate, rubbish food, physical inactivity, chronic stress is a certain contributor, inadequate sleep, and then the genetic factors. So we've talked a lot about nutrition. That's probably one of the most important ones, but there is other pieces to it. All these diseases are associated to it: type 2 diabetes, pre-diabetes, obesity, not a disease, but a sign that the body's struggling. High blood pressure, heart disease, strokes, fatty liver, gout, some cancers, dementia, Alzheimer's and vascular, inflammatory things such as some types of arthritis and things like that, polycystic ovarian syndrome. There's a theoretical increased risk of getting blood clots in your legs, kidney disease, and it's associated with depression and anxiety. So all of that's there. What we do, typically in medicine, is we then think, okay, you've got these, we need to give you some drugs to treat them, or actually you need to go and eat less fat and more carbohydrate. So we drug all of this. But actually, what you can find is you can't reverse all of those things, but you can make a significant amount of them better by dealing with those bits and pieces. So eating real food, being physically active, getting adequate sleep, and taking steps to reduce chronic stress. And that makes an enormous difference, an absolutely enormous difference. And where we are now with healthcare, we need to start spending a lot more thought on that. So I'm going to go through the sort of more practical things. Just note on fructose, fruit sugar. So fructose doesn't tend to raise your blood sugar levels, so people have thought, well, that's okay, that's great. I think, my personal opinion, if it wasn't for fructose and sucrose, which is table sugar, which is a glucose and a fructose molecule together, I don't think we would be where we are now. I think sugar's broken people, and then the carbohydrates become a problem, because there are all these cultures around the world who, for centuries, have probably eaten quite a lot of starchy carbohydrate. It'd be much better quality, unrefined and all the rest of it, but it didn't have sugar. My personal opinion is what happens is something along the lines of eating too much fructose and sugar knackers the body, and it stops the body working properly and starts developing this insulin resistance and high insulin level, and then the vicious cycle starts. So that sort of answers the question, well, hang on a minute, people have eaten that sort of food for years, and they've been, what's happened now? And I think it's this. So just very quickly, fructose, this fruit sugar, has to be dealt with in the liver. The rest of the body can't use it. And the liver deals with that mainly by turning it into fat. And eventually it gets laid down as fat in the liver and the pancreas, and that causes this issue of insulin resistance, and therefore contributes to diabetes. So even though fructose, people think fruit's great, let's eat lots of fruit. Fruit juices are just loaded with fructose, obviously, and table sugar, and high fructose corn syrup, which is made out of corn, obviously, in the States. That's what's driven this problem, I think, and I think that's what's broken us. So if sugar had never come along, we probably could have eaten as much rice, bread, and all the rest of it we want, as long as it was quality, unrefined stuff. So I think that's a really important note to take. And with that, our fruit that we eat is massive and sweet now. And in this country, we also lump our fruit and veg together, 5 a day, fruit and veg. Other countries, they don't. They say, eat loads of veg and just have a couple of pieces of fruit. But we're told, go and have a smoothie, 2 of your 5 a day, it will say on the packet, or an orange juice, 1 of your 5 a day. And that's just this massive sugar load. So suggestions on how to fix this. Just quickly, remember the science is step 1. Once we've got the science right, we've got a fighting chance. But actually, going back to these questions of what matters to you, where do we start? When we watch the Fixing Dad film in a couple of weeks' time, that explains the story really, really well. And what I'm really keen to say is, people, this will work, go and do it, because we're humans. We've got complex lives, and there's a number of facets to us. And also, I think I will say, remember, people are different, so people's biology is different, and you always have to check in, is this working or is this not working? You have to do what works for you, and aim for this to be a lifestyle change as opposed to a temporary thing. So what should we be eating, which is a really important thing? So the number 1, above anything else, is eat real food. And it seems odd that we have to say that, but we have so much non-real food around us. So what is real food? Real food is food that's naturally occurred on the earth and not been changed in any way. And it's likely, hopefully, not been down a production line. And if it's got an ingredients list, stop and question it. Otherwise, it's real food. Absolutely avoid any processed food. Avoid sugar and refined carbohydrates, which are anything, something like flours or white rice and things like that. The whole grain stuff's not really any better if you're diabetic. It's still loaded with carbohydrate, obviously. Eat lots of vegetables. Generally speaking, it's above ground vegetables because they're not starchy. Lots of green veg. Stay away from tubers, which are things like potatoes, but some root vegetables, having some root vegetables are fine. So really, real cutting-edge sciencey food here. It's stuff we don't see very often sometimes, actually. And then you can very much enjoy healthy fats, because if you are going to stop eating so much carbohydrate, you have got to get your calories from somewhere. This is not about calorie restriction. You can trust your appetite. Once you get your insulin level down, you can behave like any other animal on earth. Eat when you're hungry, not eat when you're not hungry, and the body will look after you. So it's very important to remove this absolute fear of fat that we've been trained to have, which is a real challenge for people. My wife, it took her about a couple of years of me talking non-stop about it to be persuaded. But yeah, we have to remove that. And healthy fats, what are healthy fats? Fats are naturally occurring on the earth without having to be processed, such as olive oil is probably the one no one argues with. I personally have no concern about butter and things like that. I will quite happily eat that. And then you can enjoy fish, meat, dairy, eggs, nuts. This isn't a high-protein diet necessarily, or high-protein lifestyle, what way you should eat. It's just sort of a normal amount. The body can only use a certain amount of protein today, so just a normal portion of meat is fine. And then Vicky will be able to tell tell us more on this, but if people are vegan, they have to get their protein from somewhere. So I think legumes and nuts and pulses are better. Is that right, Vicky? Is that the good options? If somebody's very, very, very diabetic and can't handle carbohydrate, I think that can sometimes be quite tricky. But I have patients who are vegan who are doing marvellous things. Diabetes has gone away, and they're still vegan without having to switch on to eating meat and things if they didn't want to. Just quickly, if you are interested in this stuff, when you go looking, what was he talking about? What would you call this? There are various names for it. I'm always very careful what you call things, because what you call things matters, and people's brains frame things in different ways when they hear it. But some people call this the higher fat Mediterranean diet, which is generally an accepted term now, which is why I think they use the phrase Mediterranean diet, because the Mediterranean's right, it's always great. Some people are calling this low carb, some people are calling this low carb healthy fat, some people were calling it low carb high fat, which again I think is fine, but if you hadn't heard about this stuff before, that will sort of flick on the emotions in some people's brain. In South Africa they call it banting, after a doctor 100 years ago who was treated diabetes this way before we came along 40 years ago. So all of those things, if you type them in on Google, you would come up with similar ideas. This is just sort of reiterating again what we can eat. This is off the Public Health Collaboration website, really useful website. What it shows here is carbohydrates in the bottom, minus sign that side, plus sign that side. You kind of stay more this way. If you're, I eat this way, I'm not diabetic, but I kind of choose to stay this way. If people are very healthy and what works for them, they can have any of that. They might choose to stay more this way. There are some people you will meet that could eat massively down that end and never put on weight and always healthy. Some people are genetically like that, that's fine for them. See what works. And then the top bit, you kind of have as much of that stuff as you want. So ideally the fat should be fat that's part of food, so cheese and eggs and avocados, chicken. If you like liver's apparently one of the best superfoods around. Full fat Greek yogurt, and then over that side they've got olive oil, butter, coconut oil, tea and coffee to drink, and that will work. How you know it's working for you? So there's something called the insulin tire, which is fat around your middle. Insulin will put fat around your middle. So if you're kind of here, and there's a bit of fat on your tummy, you're thinking, how do I get rid of that? You just need to shift this way a bit, drop your insulin, and the insulin tire will start disappearing. That's a sort of one easy measure for yourself. There's blood tests we can do that show out what else is going on. So it's personalised. You've got to test it for yourself, but that's the general theme, and that you can get that online. And we'll hand out a leaflet with resources later. One of my personal ambitions, so my mission optimising individual population health and wellbeing, I think it would be absolutely amazing if we can drive the changes in Wales and make Wales a real food city. If you could walk into a cafe and there was an option to eat, we don't say they have to change. They'd have to change the whole menu, but at least one or two options that fitted with this, because our environment's so important. And with that, if we can support local farmers and get the ecosystem working better for every aspect of our lives, and then spread that across Mendip and then Somerset and UK and the world. And we'll get Elon Musk on board and go to Mars as well. I think that's his plans. But this stuff's happening all over the UK now and all over the world, so the dots are connecting. But it'd be great if Wales was the first. We could shout about it. Okay, thank you.